Stop. Before you flush, look down. Yes, I'm being completely serious. What you just did a few seconds ago might have revealed one of the earliest warnings your body can give you. Or, if you weren't paying attention, you may have just ignored a sign that something inside you is going very, very wrong. Most people don't realize this, but your stool isn't just waste. It's a diagnostic report, a color-coded health alert system, and often the first indicator of disease long before symptoms like pain or fever ever appear. And here's the scary truth. Most people never look. They flush. They forget. And by the time the real symptoms show up, the damage is often already progressing. Today, I'm going to walk you through a 7-color stool chart that doctors use. And I'm not exaggerating when I say this. 3 of these colors can signal life-threatening conditions. If you ever see them, even once, you need to take action immediately. Stay with me, because what you're about to learn could legitimately save your life or the life of someone you care about. 1. Brown, the normal standard. Let's begin with the most uninteresting but most important color, brown. Light brown, medium brown, dark brown. All variations are perfectly normal. This means your digestive system is functioning smoothly. But here's the part many people don't know. Why is poop brown? It's not from the food you eat. It's from bile, a greenish-yellow fluid produced by the liver and stored in the gallbladder. As bile moves through your intestines, gut bacteria break it down into pigments, especially stercobilin, which transforms the color into brown. So when your stool is brown, it tells you. Your liver is producing bile normally, your gallbladder is releasing it properly, your intestines are processing food at the right speed, your gut bacteria are doing their job. In short, all systems are operating in harmony. But when that brown shifts too light, too dark, or drastically different, your digestive rhythm is disrupted. And that's when your body begins waving warning flags. Now, you might be wondering, what if my stool is just slightly lighter or darker? No problem there. Darker brown, usually caused by red meat, iron supplements, or dehydration. Lighter brown, often from eating a lot of carbs or dairy. Still normal. But once stool becomes almost black or almost white, we step into dangerous territory. We'll get to that. But first, let's decode the next surprising color. 2. Green, the fast transit warning. You walk into the bathroom, look down, and suddenly it's green. Hulk green. Instant panic. Am I dying? Is this a disease? Did something rupture? Take a breath. Most of the time, green stool is harmless. Here's the scientific explanation. Remember bile? It actually starts out green. Normally, it turns brown only after bacteria in your intestine have enough time to break it down. But when food travels too quickly through your gut, due to diarrhea, infection, or stress, the bile doesn't fully change color. So it exits your body still green. Common triggers include fast transit due to illness, food poisoning, stomach flu, viral or bacterial infection, stress-induced rapid digestion. Ever get nervous and instantly feel the urge to go? That's because stress hormones accelerate intestinal movement. Dietary causes. Eating large amounts of spinach, kale, broccoli, chlorophyll pigment green or blue sports drinks, green frosting, candies, or food coloring. All harmless. If the green stool comes with severe abdominal cramps, fever, dehydration, it lasts more than 48 to 72 hours. This could indicate a gut infection, such as Salmonella, coli, giardia, or other parasites. In these cases, bacteria or parasites irritate the intestines, speeding up movement and preventing proper bile breakdown. Infections don't just go away. Many worsen without treatment. Yellow poop, when your body can't digest fat. Now we're moving into a category that should never be ignored. Yellow poop. Not beige. Not light brown. I mean bright mustard yellow stool that looks oily, feels greasy, floats on the surface, and carries a strong, unusually foul odor. If that's what you're seeing, your digestive system is sending a very clear signal. Your body is struggling to absorb fat. This isn't just about diet. This is about a deeper problem affecting how your digestive system breaks down and processes nutrients. Normally, when you eat fat, 3 things must happen. 1. The gallbladder releases bile to emulsify, break apart, fats. 2. The pancreas releases digestive enzymes, especially lipase, to chemically break down those fats. 3. The small intestine absorbs the fat molecules. If any of these steps fail, fat moves through undigested. Undigested fat gives stool a yellow, greasy, floating appearance, a condition called steatorrhea. Fat literally floats because fat is less dense than water, and the grease coats the stool, making it slick, pale, and smelly. What causes yellow, fatty stool? Let's break down the science. 1. Pancreatic insufficiency, the most common cause. Your pancreas produces enzymes that break down fats. When the pancreas becomes inflamed or damaged, enzyme production drops. Conditions that cause this include chronic pancreatitis, often from alcohol, smoking, or autoimmune disease. Pancreatic cancer, cystic fibrosis, blocked pancreatic ducts. When lipase is low, fat passes through almost untouched, the classic bright yellow fatty stool. 2. Celiac disease. Gluten damages the gut. Eating gluten when you have celiac disease causes the immune system to attack the small intestine. That destroys the villi, tiny fingers responsible for absorbing nutrients. Once those villi are damaged, fat isn't absorbed, vitamins are wasted, yellow steatorrhea appears. 3. Gallbladder problems, not enough bile. If your gallbladder isn't releasing bile properly, fats stay in large, undigested droplets. This can happen with gallstones, bile duct blockage, gallbladder removal, post-cholecystectomy, biliary disease. Again, you get that yellow, shiny, oily stool. If this happens once, it might just be a very greasy meal. But if it continues for multiple days, you losing weight, you feel weak or fatigued, you have abdominal discomfort, it's time to see a doctor. Prolonged fat malabsorption leads to vitamin A deficiency, night blindness, vitamin D deficiency, bone pain, immune issues, vitamin E deficiency, nerve problems, vitamin K deficiency, easy bruising/bleeding, malnutrition, and muscle loss. Never ignore repeated yellow, fatty stool. Your body is telling you something is fundamentally wrong. Black poop, the hidden sign of internal bleeding. Now we enter the category that demands immediate medical attention. Black poop, not very dark brown. I'm talking about jet black, tar-like, sticky stool that looks and smells like roofing tar. This appearance has a medical name: melena, digested blood from internal bleeding. This is one of the most urgent warning signs your digestive system can give you. If bleeding occurs high in the digestive tract, such as the stomach, the esophagus, the upper small intestine, the blood stays inside long enough to be exposed to stomach acid and digestive enzymes. When this happens, 1. The acid breaks down the blood. 2. The iron inside the blood oxidizes. It turns black. 3. And the stool becomes thick, sticky, and tarry. That's melena, and it almost always means serious internal bleeding. Major causes of black, tarry stool. 1. Stomach ulcers. These are the most frequent cause. Ulcers may develop from H. pylori infection, long-term ibuprofen/NSAID use, heavy alcohol consumption, stress-induced erosion of the stomach lining. When an ulcer erodes a blood vessel, you bleed internally. 2. Esophageal varices. These are dangerously swollen veins in the esophagus, often seen in people with liver disease, cirrhosis, long-term alcohol damage, portal hypertension. When these veins burst, bleeding is massive, and melena appears. 3. Gastritis. Inflammation of the stomach lining can cause small but persistent bleeding. 4. Upper GI cancers. Less common but possible. Stomach cancer. Esophageal cancer, small intestine tumors. Not everything that turns stool black is dangerous. A few harmless causes include iron supplements, Pepto-Bismol, bismuth subsalicylate, black licorice, blueberries, activated charcoal. Symptoms that often come with melena. If blood loss is significant, you may also feel weakness, rapid heartbeat, shortness of breath, dizziness, or fainting, pale skin, cold sweats. This is anemia from internal bleeding. What to do? If you see black, sticky tar-like stool, don't wait. Don't Google that, don't self-diagnose that, don't hope it goes away. Go to the ER immediately. Internal bleeding can progress rapidly, and catching it early can save your life. Red poop, blood, or beets. The critical difference. Let's break down one of the most panic-inducing colors people see in the toilet: bright red stool. If you flush, look down, and suddenly see red, your mind instantly goes to the worst-case scenario. Is that blood? Am I bleeding internally? Sometimes yes, but not always. And understanding the difference could either save you from unnecessary fear or help you catch a dangerous condition early. Before we talk about serious causes, let's start with foods. Certain pigments move through your intestines without being fully broken down. When that happens, they color your stool. Common culprits include beets, tomatoes, cranberries, red food, diet, sports drinks, like Gatorade, red gelatin, desserts, watermelon. These pigments survive digestion and can stain the stool red or reddish pink. If you've eaten anything red in the past 24 hours, this is likely all it is. Totally harmless. But what if you didn't eat anything red? That's when red stool becomes more concerning. Rule of thumb: bright red blood equals bleeding in the lower digestive tract. That includes the colon, the rectum, the anus. This blood hasn't been digested yet, meaning the bleeding is happening close to the exit. Most common causes, usually not dangerous. 1. Hemorrhoids, swollen veins. Hemorrhoids are veins around the anus that burst easily when you strain. The bleeding is usually bright red, seen on toilet paper, seen on the outside of the stool. It may sting or itch, but it's not life-threatening. 2. Anal fissures, tiny tears. These are small cuts caused by passing hard or large stools. Symptoms include sharp pain during bowel movements, bright red streaks of blood, sensitivity afterward. Again, painful, but not medically dangerous. The serious side: when red stool means trouble. Sometimes red stool is a warning sign of deeper problems inside the colon. Possible causes include colorectal polyps, growths that can bleed. Some are precancerous. Colorectal cancer, one of the most common cancers worldwide, but also one of the most treatable if detected early. Inflammatory bowel disease, IBD, includes Crohn's disease and ulcerative colitis. These conditions make the colon inflamed, fragile, and prone to bleeding. How to know if it's serious? Here's the difference between minor bleeding and a red flag. Likely harmless, hemorrhoids/fissures. Blood is bright red, blood is on the toilet paper, blood is on the outside of the stool. It happens only once or twice. It appears after straining. Likely serious, seek medical help. Blood is mixed into the stool. There's a lot of blood in the toilet bowl. Bleeding keeps happening for days or weeks. The stool looks marbled. With blood you notice clots, you see mucus plus blood. Bleeding comes with unexplained weight loss, abdominal pain, fatigue, narrow, ribbon-like stools, changes in bowel habits, persistent diarrhea or constipation. These are signs the bleeding may be coming from the colon itself, not just the surface. White or pale poop, the liver emergency. Here's the color doctors fear the most: white, pale, or clay-colored stool. If your poop looks like chalk, wet putty, or light gray clay, this is an urgent medical warning. Why? Because it means your stool contains no bile. Normally, the liver makes bile. The gallbladder stores bile. The intestines use bile to digest fats. Bile turns stool brown. So if poop is white or pale, that means bile is not reaching the intestines at all. This can only happen if the liver stops producing bile or something blocks the bile ducts. Either way, it's an emergency. Let's break them down. 1. Bile duct obstruction. A blockage prevents bile from entering the intestines. Causes include gallstones, tumors, pancreatic inflammation, scar tissue, cysts. This is often accompanied by jaundice, yellow skin or eyes, dark urine, tea-colored, pale or white stools, itchy skin. 2. Hepatitis. Inflammation of the liver from viral infection, Hep A, B, C, alcohol damage, autoimmune disease, medications. The liver becomes too swollen to function properly. 3. Cirrhosis. Advanced liver scarring stops bile production, often caused by alcohol, viral hepatitis, fatty liver disease. 4. Liver or bile duct cancer. Rare but possible. 5. Severe pancreatitis. The inflamed pancreas can squeeze the bile ducts closed. If your poop is pale, look for these symptoms: dark brown urine, yellow eyes or skin, sharp abdominal pain, especially upper right, nausea, loss of appetite, persistent fatigue. Together, these symptoms mean your liver system is in crisis mode. Get medical care immediately. Most of the time, orange stool is linked to your diet, especially foods rich in beta-carotene, such as carrot, sweet potatoes, pumpkin, butternut, squash. Your body converts beta-carotene into vitamin A, and the excess pigment passes through your stool. Totally normal. Medications can also cause this. Certain antibiotics, antacids containing aluminum hydroxide, supplements with high beta-carotene. When is orange poop serious? If the stool is orange plus oily/greasy, orange plus diarrhea, orange that lasts more than a few days, it may mean food is moving too quickly for bile to fully process, or that bile flow is partially blocked. This is similar to the early stages of what we discussed for pale stools. If orange stool sticks around or comes with pain, nausea, or jaundice, mention it to your doctor. Your body communicates with you every single day, through your energy, your appetite, your sleep, and yes, through your stool. Ignoring poop color is like ignoring a warning light on your dashboard. Sometimes it's nothing. Sometimes it's your body begging for help. Either way, awareness can save lives, including yours. You've just discovered 7 different stool colors, and now you know the truth. Some of them are completely harmless, while others are urgent danger signals your body is begging you not to ignore. Out of all 7, 3 colors, black, red, and white, are true medical emergencies that require immediate action. So here's what I want you to start doing from today forward. 1. Pay attention before you flush. It might feel uncomfortable or embarrassing, but a 5-second glance into the toilet bowl can literally save your life. Your stool is the final report card of your digestive system, your liver, your pancreas, your gut bacteria, your diet, and even your internal bleeding risk. Ignoring it is like ignoring the check engine light on your car. Small problems can turn into deadly ones. 2. Know your personal normal. Everyone has their own baseline. Maybe your stool is medium brown most days, maybe slightly darker if you eat iron-rich foods, or lighter after dairy-heavy meals. When you know what's normal for you, any deviation becomes obvious, especially sudden shifts in color, shape, texture, or smell. These changes are often the earliest signs of gastrointestinal disease, long before pain or external symptoms appear. 3. Don't wait when you see the danger colors. When stool turns, black and tar-like, possible upper GI bleeding bright red, lower GI bleeding white or clay-colored, bile duct obstruction or liver crisis. These aren't mild issues. Black stool can signal a bleeding ulcer. Red stool can be cancer or inflammatory bowel disease. White stool can indicate gallstone blockage or severe hepatitis. These conditions don't improve on their own. They worsen with time. If you see these warning signs, don't wait a week. Don't hope it disappears. Get medical help immediately. Most people have no idea how much their stool reveals about their internal health. Many older adults, especially, miss early warning signs simply because they never look. Send this to your parents, your siblings, your spouse, or anyone you care about. This knowledge could be what prevents a major illness from going unnoticed until it's too late. Your body communicates constantly. Pain, energy levels, appetite, skin changes. But your stool is one of the clearest messages it sends. It doesn't lie. It doesn't hide symptoms. It shows you exactly what's happening inside where you can't see. Listen to it. Protect yourself. Take the signals seriously. And I'll see you in the next video.